becoming Fifi MPH. If this is your first time on this channel, thank you very much for stopping by. If you've already subscribed and you're watching yet another video, thank you so much for staying with us. Please, today we are talking about post-immunization pain and what to do. I really get people asking me on Facebook and WhatsApp about what to do when their child is in pain post-immunization. Now I want us to know that, you see this red book that Ghana Health Service has been sharing for us, is it pink? Oh, color. This pink book or red book that Ghana Health Service has been giving to you pregnant women or we pregnant women, it is very important. Open to the page that is talking about immunization. You are supposed to know at which weeks your child is supposed to receive what medication. I'm not asking you to chew these things in your head because it is not your duty. However, you should have a fair idea that at 6 weeks, when your child is newly born, your child is supposed to receive this immunization. That is okay. At 6 weeks, you should know that, at 10 weeks, you should know. Open shame. It's not for fun. It's not for you to just put in your weighing bag. Anyway, your antennas and say, bra, weighing next week Friday you just take your bag and you go to antennas. No, know these things. They are important because baby, like I said, is yours. I'm a health worker. I want baby well. I want you well. However, that baby or this baby is your baby, so you should know these things. Please, in this video, we are going to talk about some tips. Like I always say, this is not written in golden words. Listen to what your midwife or your health worker is telling you because they are yours, quote unquote. But this is my advice as a mother of two and as a medical doctor as well. Please stay around. If you haven't subscribed, do not forget to subscribe. Time with Dr. Adams. So imagine you just go home after receiving vaccination, after baby receiving vaccination. Baby is in pain, baby is very fussy, baby is crying. So usually your midwife or your doctor or whichever health personnel you saw at the hospital will tell you that when you get home, give baby paracetamol. Some of our parents might say, oh, the baby doesn't feel pain. Please, babies feel pain. They are human beings. Their nerve endings are really, really working. Please, they feel pain. So usually you get home, ask your midwife. Usually we use their weight to calculate how much of paracetamol we are supposed to give them. Ask your midwife if you do not know. Pacho me man a parahi, or say man 1.5 mil, or say man 2 meals, or say man 2.5 meals. When you get home, give it to baby. Do not stop at that. Ask Pacho how many times I made fan one. They will tell you that, oh, so we do fear area where when you get home in the afternoon, you can give one, in the evening too, you can give another one. If baby is not in pain the following day, you can stop. Or we can go further and tell you that if you feel baby is in pain the following day, you can also give morning, afternoon, evening for 2 days, then you stop. It depends on how fussy your baby is. And you can find out if baby is in pain by touching the side or even gently lifting the legs. So we are going to use my model, Fifi MPH. So you just go home and usually, let me start with the abetipanye. This injection we usually give on the first day. If you do not get it on the first day, maybe the first, second, third day, they might give it to you depending on the availability. Please, when you get home, we tell you, do not rub that site. I repeat, do not. That's a BCG. It's against tuberculosis. Do not rub that site. If you want to bath baby normal as you normally do. Do not go and rub anything and go for herbs. Oh my, miss for herbs. Please. That site doesn't need any herbal concoction or anything. It might well. Every baby is different. It might well. A bit my croak a crabby na ewu. Obi so dear any crow and once obi will say a why can say na ye a healing obi dear bay a petche. And your petche now you are worried. Please come to the hospital. Anything you am sending Koima. If you don't come, they might still pay me anyway. But please come. Walk one injection. And why a peche? And why you are worried? Your neighbor is saying this. Your in-law is telling you this. You want to do what's best for the baby. Find bra. Bra, my can't say it's okay. Come and let me tell you it's okay or it's not okay. Apply this. But do not stay at home and apply any leave be a baby near so okay? Just leave it. It's normal. and korabeso. However, with the Thai injections, it is very painful. But I could be when we have 80 times. What's your book, Numa? When you look into the book that I've told you to go look. Yes. So please, we advise that when you go home, you give the child paracetamol. Ask the midwife how many times and how much you should give the baby. And then when you go home, they will tell you, say, fancy your new ice block. This is ice water. I didn't put it in the freezer, so it's not ice block. Please, if you this thing, you can just put it in the freezer and it will become cold or hot. If you do not have a freezer and you just buy ice water, you can use this. But I always tell mothers that aqualano, don't forget, people will say that they don't feel cold or they don't feel heat. It's not true, they feel it. So please, if you are using this now, so I always say, get as a handkerchief and then you wrap it around it and you place it at the site of the injection. I'm going to demonstrate for us to see. So VVMPH is our model. You can feel it when you do it. When you go like this, you can feel it, the site of injection. Or just by looking at it, you can see where the child was injected. All right. So you take your ice block or the ice water. Make sure you are feeling the cold. If this is not so cold enough, then you don't need this. But if it is ice block, I beg of you, you definitely need a handkerchief or a towel to cover it. Then you place it on the site. I always tell my patients, don't leave it like this for 1 minute. Natural baby, you are hurting the child. Just rub it slowly. 5 seconds, you left it up. The child will definitely be crying because it's painful and it's uncomfortable. So 5 seconds. 1, 2, 3, 4, 5. Then you left it. Then you go again, you wait a while. Oh, baby's crying. Oh, baby, sorry, mommy, sorry, okay, let's do it again. Then you go 5 seconds. 1, just at that side. 2, 3, 4, 5. 5 seconds. Then you leave it. You ask me how many times should you do this. You can do it in the morning when you are bathing baby, and in the evening as well when you are bathing baby. Okay, it's not something you are supposed to do every hour, every 2 hours, every 6 hours. No, doing it morning and evening is enough. Someone too might say, what if I don't have this at home? I got this from my fridge. Some fridges come with it. You can see. You can also put this, it's plastic. It came with my fridge. You can put it in the freezer or you can put it in the fridge and it will become cold. Then again, please do not forget to wrap something. Wrap, Wrap handkerchief around it. You do it, the injection is at both sides. You do it at the left and then the right as well. Okay, so you apply gently. 5 seconds, 5 seconds. 1, you feel the side. 2, or you can see. 3, baby will be crying and might be making some noise. 4, 5, then you left it up. Then you do it again, morning and afternoon till you feel that the hardness is gone. Please, someone will come to the hospital and say that my baby was given an injection a week ago or 2 weeks ago and the place is still hard. It is nothing, it's hematoma, blood formed in the muzzle and it's just become hard. If it really, really bothers you, please come to the hospital and let's inspect. Every day, I always tell my patient that after immunization, always check the site because some of them can become infected. It can become like a boil filled with pus or yellowish fluid, which is an infection. It can become very serious and can affect the health of your child. So every morning, if you're not the one bathing baby, if it is grandma or your in-law or your mother, whoever is helping, another person that is helping, tell the person to kindly check the site for any signs of infection. The place has become too red. Feel it. The place has become too hot. The place has become like a boil and you can see that there's a yellowish fluid inside. Do not enkomia on your doctor, please, on your nurse. Enkomia, if you see that it's become like a boil and it has some fluid in there, please bring baby to the hospital. Let's see and help you out. And then this is a bonus tip that I tell my patients. When you go home and baby is really, really in pain, when they are sleeping, you realize, especially the first 2 injections, the one at 6 weeks and the one at 10 weeks, because they are new to it, they might run a fever. That is why you give the para. And apart from that, to make baby feel comfortable, you can fold sorry, you can fold the cloth like this. PVMPH is not sleeping, so he will lift his legs definitely. But you can fold a cloth like this and put it, when he's asleep of course, and put it under those legs for him to rest his feet. This is just to make him feel comfortable. BBA, any medicine, any science. This is just a few because I have 2 children. Please, you just put it under baby's legs. You elevate it small to make baby feel comfortable, because baby is comforted, baby is happy, baby is comfortable, baby is not in pain, you, the mother, is also happy. But if you go home and your baby is all fussy after immunization, you'll be worried, and then anytime you are worried, anytime you are stressed, it will affect the production of your milk. So please, this was us again, me, myself, and Fifi MPH. Thank you for sticking around with us. In the comment section, let me know how you were able to relieve your child, your baby, from pain at home. What helped? What other ways you helped, like me using the cloth? If you have any questions, leave it in the comment section below. If you have any other comments, you have any topics you want me to cover about baby, that's a baby season because Fifi MPH. Please like, share, comment, and do not forget to subscribe. Thank you for staying with us. Bye.
Time with Dr.